Hello. Thank you for joining us today. We are really glad you are here. Please sit back and open your hearts. Here's Jim, your host of Time Out with Jim. So, let's get started.
Today we're going to be talking about bipolar disorder, which I have. Bipolar, which used to be called manic depression, is a mental health condition that causes extreme mood swings that include emotional highs, mania or hypomania, and lows, depression. When you become depressed, you may feel sad or hopeless and lose interest and pleasure in most activities. When your mood shifts to mania or hypomania, less extreme than mania, you may feel euphoric, full of energy, or unusually irritable. These mood swings can affect sleep, energy, activity, judgment, behavior, and the ability to think clearly. Mood swings can occur rarely or multiple times a year. While most people will experience some emotional symptoms between episodes, some may not experience any. Although bipolar disorder is a lifelong condition, you can manage your mood swings and other symptoms by following a treatment plan. In most cases, bipolar disorder is treated with medication and psychological counseling. Symptoms. There are several types of bipolar and related disorders. They may include mania, hypomania, or depression. Symptoms can cause unpredictable changes in mood and behavior, resulting in significant distress and difficulty in life. Bipolar 1 disorder. You have had at least one manic episode that may be preceded or followed by hypomanic or major depressive episode in some cases. Mania may trigger a break from reality, psychosis. Bipolar 2. You have had at least one major depressive episode and at least one hypomanic episode, but you never had a manic episode. Sclerothymic disorder. You have had at least 2 years or 1 year in children and teenagers of many periods of hypomania symptoms, and periods of depressive symptoms, though less severe than major depression. Other types include bipolar and related disorders included by certain drugs or alcohol due to a medical condition, such as Cushing's disease, multiple sclerosis, or stroke. Bipolar 2 disorder is not a milder form of bipolar 1 disorder, but a separate diagnosis. While the manic episodes of bipolar bipolar 1 disorder can be severe and dangerous, individuals with bipolar 2 disorder can be depressed for longer periods, which can cause significant impairment. Although bipolar disorder can occur at any age, typically it's diagnosed in the teen years or early 20s. Symptoms can vary from person to person, and symptoms may vary over time. Mania and hypomania are two distinct types of episodes, but they have the same symptoms. Mania is more severe than hypomania and causes more noticeable problems in school and social activity, as well as relationship difficulties. Mania may also trigger a break from reality, psychosis, and require hospitalization. Both a manic and a hypomanic episode include 3 or more of these symptoms: abnormally upbeat, jumpy, or wired, increased activity, energy, or agitation, exaggerated sense of well-being and self-confidence, decreased need for sleep, unusual talkativeness, racing thoughts, distractibility, poor decision making. For example, going on buying sprees, taking sexual risks, or making foolish investments. Major depressive episode includes symptoms that are severe enough to cause noticeable difficulty in day-to-day activities, such as work, school, social activities, or relationships. An episode includes 5 or more of these depressed mood, loss of interest or feeling no pleasure in all or almost all activities, weight loss when not dieting, weight gain or decrease or increase in appetite, either insomnia or sleeping too much, restlessness or slowed behavior, fatigue or loss of energy, feelings of worthlessness or excessive or inappropriate guilt, decreased ability to think or concentrate, or indecisiveness, thinking about, planning, or attempting suicide. Other features of bipolar disorder. Signs and symptoms of bipolar 1 and bipolar 2 may include other features, such as anxious distress, melancholy, psychosis, or others. The timing of symptoms may include diagnostic labels such as mixed or rapid cycling. In addition, bipolar symptoms may occur during pregnancy or change with the seasons. Symptoms in children and teenagers. Bipolar can be difficult to identify in children and teenagers. It's often hard to tell whether these are normal ups or downs, the results of stress or trauma, or signs of a mental health problem other than bipolar disorder. Children and teens may have distinct major depressive or manic or hypomanic episodes, but the pattern can vary from that of adults can vary from that of adults with this bipolar disorder, and moods can rapidly shift during episodes. Some children may have periods without mood symptoms. Some children may have periods without mood symptoms between episodes. The most prominent signs of bipolar disorder in children and teenagers may include severe mood swings that are different from their usual mood swings. Despite the mood extremes, people with bipolar disorder don't often recognize how much their emotional instability disrupts their lives and the lives of their loved ones, and don't get the treatment they need. And if you're like some people with bipolar, you may enjoy the feelings of euphoria and cycles of being more productive. However, the euphoria is always followed by an emotional crash that can leave you depressed, worn out, and perhaps in financial, legal, or relationship trouble. If you have any symptoms of depression or mania, see your doctor or mental health professional. Bipolar doesn't get better on its own. Getting treatment from a mental health professional with experience of bipolar can help you get your symptoms under control. When to get emergency help. Suicidal thoughts and behavior are common among people with bipolar. If you have thoughts of hurting yourself, call 911 or your local emergency number immediately. Go to your emergency room or confide in a trusted relative or friend, or call a suicide hotline number. In the United States, the National Suicide Prevention Line is 1-800-273-TALK or 1-800-273 8255. If you have a loved one who is in danger of suicide or has made a suicide attempt, make sure someone stays with that person. Call 911 or your local emergency number immediately. Or if you think you can do so safely, take the person to the nearest hospital ER. The exact cause of bipolar is unknown, but several factors may be involved, such as biological differences. People with bipolar appear to have physical changes in their brains. The significance of these changes is still uncertain, but may eventually help pinpoint causes. Genetics. Bipolar is more common in people who have a first-degree relative, such as a sibling or parent, with the condition. Researchers are trying to find genes that may be involved in causing bipolar disorder. Factors that may increase the risk of developing bipolar disorder or act as a trigger for the first episode include having a first-degree relative, a parent or sibling, period of high stress, such as the death of a loved one or other traumatic event, drug or alcohol abuse. Complications. Left untreated, bipolar can result in serious problems that affect every area of your life, like problems related to drug and alcohol abuse, suicide or suicide attempts, legal and financial problems, damaged relationships, poor work or school performance. If you have bipolar disorder, you may also have another health condition that needs to be treated along with bipolar. Some conditions can worsen bipolar symptoms or make treatment less successful. Examples include anxiety, eating disorders, ADHD, alcohol, drug problems, physical health problems such as heart disease, thyroid problems, headaches, or obesity. There's no sure way to prevent bipolar disorder. However, getting treatment at the earliest sign of a mental health disorder can help prevent bipolar or other mental health conditions from getting worse. If you've been diagnosed with bipolar, some strategies can help prevent minor symptoms from becoming full-blown episodes of mania or depression. Pay attention to warning signs. Addressing symptoms early on can prevent episodes from getting worse. You may have identified a pattern to your bipolar episodes and what triggers them. Call your doctor if you feel you're falling into an episode of depression or mania. Involve family members or friends in watching for warning signs. Don't use drugs or alcohol. It could just make it worse. Take your medications as directed. You may be tempted to stop treatment, but do not. Stopping your medication or reducing your dose on your own can cause withdrawal effects, or your symptoms may worsen in return. Diagnosis. To determine if you have bipolar, your evaluation may include a physical exam, psychiatric assessment, and mood charting. You may be asked to keep a daily record of your mood, sleep patterns, or other factors that could help with diagnosis and finding the right treatment. So that is the end of part one of bipolar, and we will start part two as soon as possible. But remember, materials contained on here are for informational purposes only. The content is not intended to be a substitute for professional advice, diagnosis, or treatment. Always seek the advice of your doctor or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately.
So, let's get started.
So let's get started. Today we're going to be doing the second part of bipolar, starting with diagnosis in children. Diagnosis of children and teenagers with bipolar disorder includes the same criteria that are used for adults. Symptoms in children and teens often have different patterns and may not fit neatly into the diagnostic categories. Children who have bipolar disorder are frequently also diagnosed with other mental health conditions such as ADHD or behavior problems, which can make diagnosis more complicated. Referral to a child psychologist with experience in bipolar disorder is recommended. Treatment is best guided as a medical doctor who specializes in diagnosing and treating mental health conditions, a psychiatrist who is skilled in treating bipolar and related disorders. You may have a treatment team that also includes a psychologist, social worker, and a psychiatric nurse. Bipolar is a lifelong condition. Treatment is directed at managing symptoms depending on your needs. Treatment may include medications, continued treatment, day treatment programs, substance abuse treatment, and being in the hospital for, like say, a psychiatric unit. The primary treatment of bipolar disorder include medications with psychological counseling and control symptoms to control symptoms, and also may include education and support groups. Medications. A number of medications are used to treat bipolar disorder. The types and doses of medications prescribed are based on your particular symptoms. Medications include mood stabilizers, antipsychotics, antidepressants / antipsychotic, and the medication Symbyax combines the antidepressant fluoxetine and the antipsychotic olanzapine. It works as a depression treatment and a mood stabilizer. Anti-anxiety medicine, which I'm on Klonopin. Benzodiazepines may help with anxiety and improve sleep, but are usually used on a short-term basis. Finding the right medication. With me, it took years to get on the right medicine, on the right dose, but now I'm on Celexa, Depakote, Depakote is a mood stabilizer, Celexa is an antidepressant, and Klonopin is for my anxiety. Finding the right medication or medications for you will likely take some trial and error. If one doesn't work well for you, there are several others to try. This process requires patience, as some medications need weeks to months to take full effect. Generally, only one medication is changed at a time so that your doctor can identify which medications work to relieve your symptoms with the least bothersome side effects. Medications also may need to be adjusted as your symptoms change. Side effects. Mild side effects often improve as you find the right medication and doses that work for you, and your body adjusts to the medications. Talk to your doctor if you have bothersome side effects. Don't make changes or stop taking your medication. If you stop your medication, you may experience withdrawal symptoms, or your symptoms may become worse. You may become very depressed, feel suicidal, or go into manic or hypomanic episodes. If you think you need to make a change, call your doctor. A number of medications of bipolar disorder can be associated with birth defects and can pass through breast milk to your baby. Certain medications such as valproic acid and divalproic sodium should not be used during pregnancy. Also, birth control medications may lose effectiveness when taken along with certain bipolar medications. Now, discuss treatment options with the doctor before you become pregnant, if possible. If you're taking medications to treat your bipolar disorder and think you may be pregnant, talk to your doctor. Psychotherapy is a vital part of bipolar disorder treatment. It can be provided in individual, family, or group settings. Several types of therapy can be helpful. These include interpersonal and social rhythm therapy, cognitive behavioral therapy, psychoeducation, and family-focused therapy. Depending on your needs, other treatments may be added to your depression therapy. During electroconvulsive therapy, or ECT, which electrical currents are passed through the brain, intentionally triggering a brief seizure. ECT seems to cause changes in brain chemistry that can reverse symptoms of certain mental health illness. ECT may be an option for bipolar treatment if you don't get better with medication, can't take antidepressants for health reasons such as pregnancy, or are at high risk of suicide. Transcranial magnetic stimulation is being investigated as an option for those who haven't responded to antidepressants. Treatment in children and teenagers. Medications, psychotherapy, psychoeducation, and support. Working with teachers and school counselors or encouraging support for family and friends can help identify services and encourage success. Lifestyle and home remedies. You probably need to make lifestyle changes to stop cycles of behavior that worsen your bipolar disorder. Here are some steps to take. Quit drinking or stop using recreational drugs. Form healthy relationships. Create a healthy routine. Check first before taking other medicines. Consider keeping a mood chart. Coping and support. Learn about your bipolar disorder. Education about your condition could empower you and motivate you to stick to your treatment plan and recognize mood changes. Stay focused on your goals. Learning to manage bipolar disorder could take time. Stay motivated by keeping your goals in mind and reminding yourself that you can work to repair damaged relationships and other problems caused by your mood swings. Lastly, join a support group. Support groups for people with bipolar disorder can help you connect to others facing similar changes and share experience. So that is the end of part 2. What I'm going to be talking about next is borderline personality disorder, which is something else I have to deal with. So that'll be my next podcast. Always remember, materials contained on here are for informational purposes only. The content is not intended to be a substitute for professional advice, diagnosis, or treatment. Always seek the advice of your doctor or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because it's something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately.
We truly hope that you enjoyed this podcast today. And if it touched your heart in any way, please share it with your family and friends. And please consider donating whatever your heart tells you. If you wish to do so, please go to the following link: anchor.fm/timeoutwithjim. And again, it's anchor.fm/TIMEOUTWITHJIM. WITHJIM. This will help us keep this podcast going. Thank you for listening, and until next time, keep your heart flowing, and God bless to all.